We're just going to give it one more minute. Okay, so we'll aim to start at 8:35. Okay. Okay, I think let's get started and then people can just come in as we go along. Thank you so much to all of you for joining us again today. Today we're going to be talking about fertility or infertility more so. It's my honor to present to you Dr. Sakina Amin, who's a friend and colleague who also works as a family physician in Mississauga, so in Canada. And I will hand over to her.
Thank you so much, Dr. Fatima Bin. Bismillahirrahmanirrahim. ਪਹਿਲਾਂ तो अपने खुदा ताला ਨੂੰ ਹਮਦ અને શુક્ર કરીએ કે આપણે મુમિન પેદા કીધા અને આપણે એવા અવલિયાઉલ્લાહ આપા છે કે જે આપણે બહેતરીન તરબિયત કરે છે અકામોલાનું એહસાન છે કે જે આપણે આ દુનિયાનું ઇલ્મ સમજાવે છે કે આપણે ગલે ઉતરી જાય. And then, of course, keeping this in mind, it helps us to practice our deen in a better way. So today we are going to talk about a topic which is extremely complex and actually very sensitive as well. And as a family physician, I'm going to try and simplify it as much as I can so that we can discuss what are the different types, causes, and factors that actually cause infertility. And, what are the things that we usually do to investigate it. And then, of course, we'll talk about treatment as well. So first of all, what is the definition of infertility? So this is the inability to conceive after 12 months of having intercourse, of having regular intercourse with an average frequency of at least 2 to 3 times per week, without the use of any form of birth control, which means it includes contraception pills, IUD, condoms, everything. And this can be quite a sensitive issue and stressful for a lot of patients. They get a lot of anxiety because of it, especially when there's added, parental pressure from the family members. Ke bhai shadi na itla time thai gayu che, have farzand nathi aaya. So, there's a lot of anxiety and stress involved with it as well. So it's easier if we have these conversations sooner, earlier, so that we can treat people accordingly. And it's better to do these treatments sooner rather than later. Okay, so what are the different types of infertility, right? The two basic kinds. Number one, primary infertility, in which the couple has never had a pregnancy. And secondary infertility, where the lady has been pregnant before. Maybe they've had a marriage before where and maybe now she's in a second marriage and she's not able to conceive. Or pillu farzand ne ghana time thai gaya che and pachi now for the second child she's not able to conceive. So that would be regarded as secondary infertility. All right. So before we sort of get into what are the causes and factors, we have to understand the ovulation cycle, because that's the most important sort of a concept that we need to understand, after which we'll be able to also know what are the causes and understand them better. So the first important process here, as you can see, is menstruation. And the reason that is important is because usually the day of your period is regarded as day 1. Okay, and that's when the follicular phase starts, where je ovary che ina andar eggs produce thai che. So in this phase, the eggs develop, mature, and then finally, in the fertility phase, these eggs are released. And that process is called ovulation. And that process always takes place on day 14. So that fertility phase is usually between day 12 and day 17, as you can see here. That is usually called the fertile week, where we usually will recommend that it's better to have intercourse to help with conception of a pregnancy. And then after that phase, when suppose if the pregnancy does not occur, so that's called the luteal phase, where the lining of the uterus then starts to shed, and then the period starts to occur, usually around day 28. So now, how does conception occur? Now that we have understood how the reproductive phase takes place, so of course, when ovulation takes place, the egg is released, okay? And then when the semen travels into the vagina, the sperms need to swim through the vagina and the cervix, which is the opening of the uterine tract, through the uterine cavity and the follicular tube, as you can see, and the fallopian tube, and then reach the egg. So, as you can see over here, यहाँ पर ovary છે, જેમાંથી egg release થાય છે, અને tube ના through સી જે fallopian tube છે, એના through સી uterusમાં enter થાય છે. So, the fertilization actually takes place in the fallopian tube. And that's when after the fertilization process, the zygote forms. And usually this is the time when the woman misses her period. And પછી, this zygote develops into an embryo, and while this process is taking place, it travels into the uterine cavity, and પછી implantation happens in the uterus. And then usually that's when the time when the symptoms of pregnancy occur, such as nausea, vomiting, and the heartbeat usually is able to be seen around the 7th to 8th week. And that's when we say that, yes, the pregnancy is well established because now it has become a uterine pregnancy. Okay, so there are lots of factors that influence fertility. And I'm going to talk a little bit about age because it's extremely important. And also because we have seen that as the age of the woman progresses, the quality of the egg, can be affected. And so does the ovulation, because not every cycle can produce an egg. So when in the earlier years, that is when the woman is 20 and in the earlier 20s, ovulation is more common in every cycle, and therefore pregnancy is more easy to occur. Now, some people put off pregnancy, for lots of different reasons, be it career, their studies and, getting a better job, or, other things that happen in life. But, having a family and having children is also very important. So I think we should be mindful of that. And એના માટે આપણે આકામોલા બી ફરમાવે છે ને કે દીકરીઓની શાદી જલ્દી થઈ જાવી જોઈએ. But, in no way am I saying that, women and, females and, દીકરીઓને ના પરાવવું જોઈએ. We can study and as well as have a career. But at the same time, we should be mindful that, the biological clock is sort of, ticking. So therefore, it's important to get married and have children at an appropriate age. Of course, nutrition is very important. Sometimes it can be linked with various deficiencies, specifically iron deficiency and certain vitamin deficiencies. So they can affect fertility and ovulation. Certain endocrine disorders like hypothyroidism, diabetes, can affect the hormonal cycle and menstruation. Infections such as sexually transmitted infections, can also cause can affect the fertility process. And then, of course, certain medications. So if, women are taking any medications that affect their immunity or any anti-cancer medication, of course, alcohol, smoking, muharramat se to apne dur જ રહીએ છીએ, but definitely we should be aware that these are important factors that can influence fertility. હવે, from a sort of a movement point of view, I want to point out that apne hamna sehatni વાત કીધી. Good health is, of course, extremely important. And to a large extent, it is under our control. We can, be healthy in terms of make lifestyle changes. We can have a healthy diet. We can exercise regularly. And because of all that, we can influence our ovulation and fertility. However, we also have to realize that ફરઝનની દોલત એક નેમત છે જે આપણે નસીબથી મળે છે અને જેના માટે આપણે અવલિયોલા ઘણા નુસ્ખાઓ ફરમાવે છે. આપ લોગ સગલાને તો એ રિવાયત ખબર જ હશે કે એક આરબી હતા જેના નસીબમાં ફરઝન નહોતા, પણ ઇમામ હુસૈનના દુઆ અને વસીલાથી એને 7 ફરઝન થયા. તો આપણે બી આપણે આકા મૌલાથી રઝા અને દુઆ તલબ કરવી જોઈએ for this reason. Okay, so now looking at broadly at the causes of infertility, I usually like to split it into two big problems. One is a functional problem and the other can be structural problems. जिम के अपने पहला स्लाइड में जोया कि ovulation is extremely important for fertilization, because if you have regular cycles, the egg will be released in every cycle, ovulation will take place, right? And then, of course, it will lead to fertilization and a pregnancy. So any factor that affects ovulation, for example, irregular periods, PCOS, there's a big thing about polycystic ovarian syndrome. Anybody that has irregular periods thinks that they have PCOD, but it's not necessary. So that is why it's important to, go to your family doctor and have a discussion with them. So you can see that any kind of ovarian dysfunction or hormonal changes that affect ovulation can be a big cause for female infertility. And then similarly, of course, if there's any problems with fertilization, obviously that can also lead to infertility. The other big thing is any structural problem, right? So Jim ke apne pehla slide mein joya ke after the ovulation takes place and the egg is released from the ovary, the fallopian tube picks it up, and then the fertilization actually takes place within the fallopian tube. So any reason that for which the tube is blocked or damaged, it can be from an infection or a surgery or a previous tubal pregnancy, જેના વજહ से fallopian tube damage થઈ જાય છે, એના વજહ से भी infertility થઈ શકે છે. Same thing, if there's any vaginal problem, if there's any, block to the entry of the semen or any scarring from any infection or surgery, obviously that will also prevent the semen from going into the uterine tract. The other big one is any kind of uterine defects. For example, कोई भी अगर mass होए छे, fibroid होए छे, and these are usually benign growths that occur within the uterine cavity, or any abnormal, lining problem within the uterus, that can also cause problems with fertilization and implantation. So I'm going to focus a little bit on the women part of things here. And then, of course, we'll also talk about the male causes of infertility and how we work up and investigate, the male partner. But you have to remember that, investigating and treating both is extremely important, right? Because it's a 50-50, right? And that's why when patients come to us, usually at the first visit, I always ask, the lady to bring her husband. So it's important for me to take both their histories and investigate both of them at the same time. And sometimes I find that, men are shy to talk about these things. But, we have to be open, because the earlier we have these conversations, the better it is usually overall. Okay, so usually family doctor passe, in Canada, most of our first line of level of care is the family physician. So when patients come to us, I like to know, about their background, about their occupation, what their family history is like, if they have had any infections in the past, if they've had any surgery. So I like to take a, good history so that I can see what's going on. And then, of course, the most important thing also to know is their obstetric and gynecological history. Period ke baare start thaya tha, what is the regularity of having the menstrual periods, if they've used any contraception in the past, if they've had any previous pregnancies or miscarriages. And then, of course, it's also important that at the time of miscarriage, how early was it? And was there any investigations done to figure out what the reason for those miscarriages were? So that gives us a little bit of a clue as to what could be going on. And then, of course, we family doctors love to do blood tests, but some of these are really important because they help us to figure out, common deficiencies such as iron deficiency, vitamin deficiencies. And then, of course, some of the other reasons why we can have infertility, such as hypothyroidism. So I usually do a TSH level. I also look for blood sugar, cholesterol, especially if there is a history of gestational diabetes, in the past pregnancy. It's important to check blood sugars because you can have uncontrolled diabetes, which can affect ovulation. And then, of course, we also do a urine test to see if there's any infection. So this is sort of the basic stuff that we start off with. And Apache, we want to sort of look at, in more detail, right? So first off, usually I will order an ultrasound. अगर आपने याद है तो we talked about structural problems. So a simple abdominal and pelvic ultrasound gives us a lot of information about if there's any fibroids or any polyps or any structural abnormalities within the lining of the uterus. And some of them can be very easy to treat. Um, Sometimes we also do a test specifically to look at the patency of the fallopian tubes. यानी अपने जानवू छे कि आज fallopian tubes छे blocked तो नथी, patent छे, because that is where the ovum is going to travel. The egg is going to travel through the tube, and meet the sperm. So for that reason, we do a test called hysterosalpingogram. I know it's a very complicated sort of word, but basically इना अंदर अपने एक dye pass करिए छे through the uterus, through the uterine opening, which is the cervix. And then we see whether the fallopian tubes are open by taking a series of pictures. So sometimes this can be done by the family doctor, or if you're seeing a gynecologist or infertility specialist, they will also order this test. It's a very easy test. It's not that painful, but it's a very easy test to see whether the fallopian tubes are open or not. And then, of course, it depends on what we're investigating. If we think that there is a abnormal lining in the uterus or if there's a fibroid, sometimes we will also investigate by doing either a biopsy to see if the uterine lining is, abnormal. Um, and then, depending on what we are trying to find, doctors, especially the infertility specialists, may do a test where they pass a camera through the uterus and they actually look inside to see if there's any abnormal growths. Laparoscopy is actually a last resort where it's usually done to see any abdominal sort of, masses or anything that is causing pressure on the uterus. And usually for that reason, they open the whole cavity up to see if there's anything going on. Okay, so as we spoke about for women, similarly, those factors apply for men as well. So if there are, certain diseases in the men, such as, uncontrolled diabetes, high cholesterol, or any infections, that can affect the quality and the mobility of the sperms, right? So when we are evaluating the husband or the partner, we definitely want to do some blood tests to check the blood sugar, to check for any vitamin deficiencies, see their cholesterol levels. Of course, we want to check their urine for any infections. And the most important test here is the semen analysis, because that gives us a lot of information about the sperm count, the motility of the sperms, and the morphology of the sperms. अगर आपने याद हसे જે આપણે reproductive cycle નું slide માં આપણે જોયું હતું કે the sperms have to swim through the vagina from the cervix. They enter the uterine cavity and they have to swim all the way to the tube to meet the egg where the fertilization takes place. So we have to make sure that the count of the sperms is appropriate and that they're healthy. Sometimes, men can have problems such as hernias or scrotal disorders such as hydrocele, and a lot of times they need an ultrasound to check for that. So that is why it's important that if you are noticing any abnormal growths or any swelling in the genital area, you should discuss this with your family doctor and get an ultrasound done. And a lot of times, these conditions can be easily treated with surgery. All right. So once we have sort of evaluated, what the factors that could be causing infertility, and we have gone through the tests. We want to talk about treatment, right? Um, Again, as with everything else, lifestyle changes are key. Sometimes it's just about, making certain lifestyle changes and having a healthy diet, maintaining, a healthy weight, exercising regularly. And this can help with, getting the periods to be regular. It helps with ovulation. And a lot of times that, solves our problem. And the other important thing is to treat the deficiencies. Remember, I did mention that we have, very common deficiencies that occur in women, such as iron deficiency, B12 deficiency, and just by supplementing these, these vitamins and minerals, we can do a lot of good. And I actually want to bring out an important point here about vitamin D deficiency. There are a lot of studies that actually prove that vitamin D deficiency, especially in the northern countries like Canada, has been linked with infertility. So it is very important as a part of the fertility workup to check the vitamin D level. And if it is low, we should be treating it, with high doses. And not only that, we should be giving regular supplements to help maintain the vitamin D level. Then, of course, you can see that, we want to correct any hormonal disorders, right? Like we said, if there's uncontrolled diabetes or thyroid problems, obviously we want to treat those as well, because that will ensure that ovulation is taking place and a healthy egg is formed. Um, So there are a lot of supplements, that are, talked about and given by family physicians to help with fertility. Sometimes I'll just tell people that, you know what, eat good food, eat healthy food, eat fruits and vegetables, they have everything. But, if we really have to, talk about supplements, because JB patients have lemon puche che me supplements sulav. So, for that reason, I kind of put this in that, it is important. There's a lot of studies that show that omega-3 helps. And if you are with a certain age, like for example, if you're above 30 or 35, we do recommend taking folic acid. Usually we recommend high doses of folic acid for prevention of spinal neural defects. So that's something that, that we usually will, make sure that patients are taking. Preconception prenatals is also recommended by family physicians. It is important, definitely, because remember, if there are any deficiencies, that can affect your cycles and affect the quality of the egg. There's a lot of prenatals available in the market, such as Materna. A lot of them are now gelatin free. They are halal. Some of them are also available by prescription. So, make sure that you ask your family doctor about that. Um, I'm going to talk a little bit about acupuncture here, because as I was doing some research and when I was talking to a lot of my colleagues who do acupuncture, such as naturopathic doctors and chiropractors, there's a huge science developing in this regard, where they're recommending acupuncture to help with the regularization of periods and also to help with ovulation. In fact, acupuncture is being widely used in, fertility clinics as well, before and after certain procedures. So definitely, if you do have any insurance or extended benefits, you should look into it. Okay, so as we mentioned, initial part of the treatment is to, cover the deficiencies, and then making sure we have a healthy lifestyle. But now, we have done all of that, and when we come to this level, most of the times, either you have been referred to a gynecologist or an infertility specialist. So I just want to make you aware of what are the treatments available, that when you do actually end up seeing a specialist, what would they recommend? So definitely there are lots of medications that are given to help with ovulation and maturation of the egg. So by this time, usually when you are seeing a fertility specialist, they will do something called cycle monitoring, where, if you remember, they will be monitoring the growth of the egg in the fertility phase, that is immediately after your period, to see if the egg is actually growing and maturing as it should. Um, and then, of course, sometimes, surgical procedures can be necessary to correct the uterine abnormalities. For example, apne baat ki thi ke there can be lots of growths within the uterine cavity, such as polyps and fibroids. So there are lots of, procedures recommended. And usually these are simple, these are easy, they're not major surgeries. In fact, polyp removal is a office procedure. They usually use a camera and go in and then they look at it and they're able to remove it using a hysteroscope or a camera. Fibroids, if they are big and if they are more than a certain size, and if they're distorting the uterine cavity or preventing implantation, then usually a procedure called myomectomy is done, where they again use a camera and they're able to sort of scoop out that growth or that fibroid from the uterus. Okay. So there's always a big sort of importance given to these procedures. I'm sure you all have heard of it. So I'm going to talk a little bit about it in detail, and I hope you understand that. And of course, if there are any questions, we'll talk about, we can discuss that as well later on. So alternative female infertility treatments, is what we're going to talk about. And you can see that there are two that I've listed over here, IUI and IVF. So IUI is basically intrauterine insemination, which means that we take the semen and that is artificially injected into the uterine cavity. And then the semen travels through the uterus, and then the sperms then go into the fallopian tube and meet the egg where the fertilization takes place. So as you can see, this mimics the natural process as close as possible, right? And then, of course, you must have heard of IVF, which is called in vitro fertilization. And in this procedure, the egg is actually taken out of the ovary. Usually, while the cycles are being monitored, the egg maturation is followed. And then when it is mature enough, this egg is extracted from the ovary. And then the sperms are collected from the semen. Sometimes they're washed and processed. And then this process of fertilization takes place, in an artificial setting, which is outside the body. So as you can see over here, the IUI, sort of mimics the natural process, is similar to the natural process, whereas the IVF is sort of an artificial procedure. So Khali apne, as a woman, I would like to point out that IUI, because it being, close to nature, it can, માટે આપણે રજા મંગાવી શકે છે. But because IVF, કુદરતના ખિલાફ છે, તો આપણે એહતિયાત કરવું જોઈએ, because એ મોલાને નાપસંદ છે. And the other thing I want to sort of point out here that, we should also consider adoption as an option. It's quite a viable option. And agar apne, lage che ke this is the last resort, we should definitely start a conversation and start talking about it. Okay, so as we talked about, women and infertility problems and how we treat it, obviously we should be correcting the infertility causes in men as well. As I mentioned before, I think sometimes husbands and males are, a little bit shy, and it is important that when, women are being tested and investigated, we should be investigating their partners at the same time as well, just because we want to save time. And also we want to make sure that, we are treating any, reversible factors at the same time. So, correction of deficiencies, men can also have iron deficiency, vitamins deficiency. So it's very important to correct those. Sometimes I've seen uncontrolled diabetes and hypothyroidism in men. that can cause, problems with their sperm function. And as soon as we correct that, it can actually improve the quality of the sperms. And then, of course, as I mentioned before, if there's any scrotal abnormalities or any hernia or hydrocele or any kind of swelling in the genital area, men should make sure to get that investigated. At the same time, there can also be lots of problems with erection and erectile dysfunction. And I think that that's an important conversation that, the husbands should be having with their family doctor as well, because they're easily managed. And then once we have treated those, definitely, it makes the journey much easier. So thank you so much for your time. I really appreciate your listening to me. And, if there are any questions, I'm happy to answer them.
Thank you very much, Sakina. That was really, really useful. Very informative indeed, and I hope everyone got something to benefit from it. I just wanted to kind of touch on, this idea of fertility being a female versus male issue, because I think, it's something that as women, we normally really get affected by it, and we always consider that if we're not getting pregnant, this is our problem. And I think, we get a lot of issues where men are just not keen to go and get tested and things like that. And also the stigma that's associated with the idea of not being able to conceive, right? And how that psychological impact can actually affect fertility in itself. And just that stress for both the men and women, like when they know that they're pressured and they're trying really hard, and this month it didn't happen again. You get your period, you cry, you go through the cycle again, and then you're trying, and the whole thing is riddled with stress, and how that can actually affect fertility in itself.
Yeah, absolutely. And that's why can be quite stressful and anxiety provoking, and especially in couples, who are trying. That's why it's important that if you have tried for 6 months to 1 year, and if you're having difficulty and some problems, you should get investigated, get some blood work done. And, if there's any initial things to be, resolved, it's better to do them sooner rather than later. But I think it's important to also normalize, and make it sort of less stressful for, the couple, because a lot of these things are normal. Like sometimes I find patients will come in when it's just been 6 months of trying, right? So we know that healthy couples can take more than, 1 year to get pregnant. But in the meantime, it's important to sort of, do those lifestyle changes and, take the supplements and, do those other things. And of course, अपने जिम के अपने movement छे तो अपने in the meantime अपने मोला मा भी आरज करी सके छे. So just to, get that process going as well.
Yeah, and what can the family do in that situation, to help support really? Because often there's lack of understanding within, like parents-in-law. I'm sorry to say that, but it does happen a lot, right? Where there's a lot of pressure as soon as people get married. And when it's not happening, hearing those questions can really, really affect people. So what can, other people, so friends, family, what can they do to help?
I think the most important thing that, parents and family members can do is number one, be supportive, right? And not play the blaming game, and not be like, oh, you know what, it's your fault. It could just be, as I said, farzanni daulat ek nemat che, right? So, and that's sometimes not in our control. So, jivare waqt se, jivare khuda tadbir kar se, tivare tha se, right? So, I think number one, being more supportive, and just, hear them out, be their sounding board. Maybe they're just having stress at work, or, maybe there's a problem with the relationship. And, sometimes things are just not, you know, sort of cordial in between, the partners. So, just to kind of, hear them out and see what the problem is and helping them out with it. Um, like sometimes you find that couples will come in and they're so anxious and so stressed that, and a lot of times I'll say, you know what, just get out of, this work situation or this stressful situation, and maybe take a break, or, go for a vacation, and, then come back and try. So I think sometimes just to sort of take a fresh start helps.
Great.
Hi, Sakina Ben. Thank you so much for such an informative presentation. I learned a lot. Just as an extension to what Fatima Ben and you just talked about in regards to the stress that a woman undergoes when they're going through all of these investigations, the pressures at home, all the tests, like even going through all the tests, it's not always simple. It can be quite, uncomfortable, painful, side effects of medications. It takes a toll on a woman's body going through fertility treatment. What would you recommend for the female, for herself to do in order to take care of herself during the time that she's going through this, in terms of mental health support? So I know you had mentioned, taking a break, going on vacations, getting support from family and friends. But what about the role of like therapy or medications to help with their anxiety and stress? Like, is that something, especially the medication, is that something that you would recommend for them just to help to ease their anxiety and stress during this time?
Yeah, it really depends, Dr. Rashida, where they're coming from. I mean, if they already do have a history of a mental health disorder, if they're already suffering from depression or anxiety, I do usually like to put them on a low dose of medication just to stabilize their mood. But I mean, some amount of anxiety and stress is sort of normal, right? So I guess when they come to us, it's up to us to decide, whether they truly need medication. But sometimes even therapy helps. If they go talk to someone, if they take some counseling or psychotherapy, it can help ease their sort of anxiety, and it also gives them a little bit of a sounding board. Um, we actually in our clinic have a nutritionist, and she's actually also a personal fitness trainer. And she finds that sometimes just people coming and talking to her about their life, it helps to ease off their tension, right? So not everybody needs medication, I'll be honest, but yes, definitely, if they have a history of mental health disease, we want to optimize, their mood first before we get them to try, because definitely it is a stressful situation. And by the time they actually move from us to the fertility specialist, it can be quite stressful just going through that cycle monitoring process, taking medications, getting their ovulation cycles monitored. It's very, and especially when they have timed intercourse, they will usually give them, a sort of a time period where they're, it's recommended that they get more active. So, definitely for the couples, it can be quite, stress provoking. So if we can support them as family doctors, we can recommend definitely lots of different ways to ease down their stress. And there's a lot of herbal supplements as well. I actually forgot to mention that in my talk. But as I was speaking to one of my naturopathic colleagues, there's a lot of herbal supplements that they recommend. Um, for example, even the use of lavender oil can ease off, their anxiety and help them with sleep. And of course, we know sleep is extremely important because that's where all the healing takes place. So if you sleep better, obviously you're going to function better, right? Your metabolism is going to be better, and obviously you're going to have a better ovulation and chances of a pregnancy. So sometimes it's depending on the situation, we recommend different things, right?
Thank you so much, Sakina Ben.
Okay, so we'll hang out for a few more questions if
Yeah.
there are any. Just to remind you, our next talk is gonna just follow on from fertility, and it's gonna be on pregnancy. So we'll just be talking about the process of pregnancy, what to do, what not to do, and it's gonna be Dr. Sakina again on the 5th of June, inshallah. You can use the same link that you used today, but we'll send it out again as well. If you have any questions, we'll be around to take them. Um,
Yeah, I think I can wait for another 5, 10 minutes. If anybody has any questions, I'm happy to take them.
Perfect. Thank you. Nabin, do you find that a lot of like the patients that you get that come in for fertility concerns, a lot of the time that you don't necessarily need to refer them, like they're just coming really early? Because I find that there's a lot of anxiety and lack of knowledge really for what's normal. So usually, when people hear from their friends that you've been trying for 3 months and you're still not pregnant, so often they'll come to me around the 2 or 3 month mark saying we've been trying and nothing's happening. Please help me. I'm really worried. Are you
Yeah, a
finding
lot of
that?
times you get the other side as well, where, they've just tried for 3, 4 months,
Yeah,
and I think the worst thing that they can do is Google things, and sometimes their friends can be quite misleading because they'll say, "Oh, I just tried for 1 month and I got pregnant,"
yeah, get
and
that a lot too.
that's actually so rare that, it's just most people will try for at least 6 to 12 months, right? Before
Yeah,
healthy couples. We're talking about healthy couples here. So I think it's important to educate couples as to what's normal, and, sort of tell them that it's okay. And then I think I usually will educate them about, the fertility cycle and what's the fertile week, and, how they can be healthy. And this is a chance where we can talk about giving them prenatal vitamins and folic acid, and, talk about healthy lifestyle. And um, so I think usually, after you've calmed them down and reassured them, most people feel better about it.
yeah. I'm finding the same actually. There's just a lot of people that just come in because they're panicking, or just because they're 31 or 32, and they're just like, I need to get pregnant quickly. What do I do? Can you refer me? Just, feeling like is
Yeah.
if they're in the system, it will help, and often it doesn't because it's just that anxiety that also limits it too, right?
Yeah. I think, at least, with us, I think mostly they recommend sending out referrals after 1 year,
Yeah.
not being able to get pregnant without
Yeah.
the use of a contraceptive. So, that's usually my first, or, one or two questions, and, like, how long have you been trying and what you've been doing? Um,
Yeah.
and and I think sometimes staying with us as family physicians is a little more comforting for them, because as soon as it starts seeing the fertility specialist, it gets really stressful by that point, because you're usually trying medications, and sometimes they are doing IUIs and they're failing and not getting pregnant. So they get, obviously, that can be quite stressful and even sometimes depressing, like,
Yeah.
for patients. So it's important for us to then, give them support at that time.
And I think as a community, not just us as Women, but in terms of Asians in general, I find we make it very difficult, because sometimes people, I think, just deflect from talking about it because one, there's a lot of stigma, but two, everyone thinks it's okay to ask you when you're gonna have children as soon as you get pregnant. It's become a normal question, not realizing that actually that can be really difficult for people who are having fertility issues. Like even hearing that question and having to answer is difficult, right? So I think
Yeah.
part of that conversation should be how to educate or re-educate older people about what kind of questions are appropriate. And I think that's just one that's not been understood to be so inappropriate.
It's like we're told, when, you see that a woman is obviously pregnant, but you don't ask them. It's not right to say, hey, are you pregnant or when are you due? It's the same kind of thing. It's like, okay, so you're married. That doesn't mean the next question should be, oh, how come you don't have kids, right? Like it's A, none of
Yeah.
one's business, and B, it's they'll decide what's right for them, and they can have kids when they want to.
Yeah,
Exactly.
but
Yeah.
sometimes I think it's in a place of, like, এলোগোনা fikar hoyeche, like they truly actually mean well for them. Because sometimes, pregnancy and having kids is deferred for lots of different reasons. As I mentioned as well in the talk, that, people are doing their post-graduation, or, they're waiting for a career, promotion, or they're like waiting to buy the, right house. And when the time is right, that's when we'll have kids. But, they may have more difficulty after a certain age, just because it's just the way nature is, because maybe their ovulation may not be, perfect. And we see a lot of miscarriages after 35, and that's usually from genetic and chromosomal abnormalities, right? And that's just because of the age factor. So, not always it's coming in, these questions are coming probably from a place of good because,
Yeah.
એ લોકોને ખબર હોય છે કે, if women are younger, they're healthier and they're able to carry pregnancy, in a more sort of healthier way, right? Because with being, above 35, you have other issues. Sometimes women have high blood pressure or diabetes, as we mentioned now, Jad. I'm sure you guys have seen it too. Gestational diabetes has become so common. First, I used to see it only in the 30s. Now I'm seeing younger women with a family history of diabetes, have gestational diabetes, and sometimes they have to take insulin, and you have to regularly test them to make sure that that their sugars are under good control. So we have to be mindful that with age comes other things. The aging process brings out other sort of issues that can hamper, normal and healthy pregnancies and conception and pregnancies both.
Yeah.
Sorry, go ahead, Fatima.
No, you go ahead. That's fine.
So I just wanted to ask, I know when you refer patients to a fertility clinic, the visit is covered under OHIP, but there are certain tests, and I think the IUI is also not covered. Do you know roughly the cost of fertility treatment in Ontario, at least? Because I don't know, some people may think that, it's covered all the way through, but I know that there are some tests that patients have to pay for, including blood tests and scans, and then also like the IUI as well.
Most blood tests are covered. Most scans are covered, except if they're doing, like a surgical procedure. Sometimes I've noticed that patients have been charged. All medications are not covered. So if they have an insurance plan or if they have extended benefits, some of them will cover maybe either 50 or 80% of it, and some of it will have to be paid by the patient. Definitely IUIs are not covered, IVF and IUIs, of course. So you can get a government grant for that, but I won't go into it because, Molani Khushi Nati, so I don't want to touch on that. But IUI, I think typically costs about $500. So if if you want to schedule that, usually there is a cost attached to it and it's not covered under OHIP. The visit and the consultation part is covered, but the actual procedure is not covered.
Okay, thank you. Yeah, I know I have sometimes patients come in saying, oh, I had to pay for this test and I had to pay for this. And so that's why I just wanted to kind of say.
What test is that? Usually, are they doing like, sometimes they do genetic testing. I've had some patients who got some genetic testing done and that was not covered.
So I'm not sure of the specifics, but it's more specialized fertility testing. I think they do that. Sometimes it's not being covered. And then, yeah, like you said, the surgical procedures sometimes aren't. But I mean, when couples are desperate, then they are willing to pay for it. So it works out for them.
Yeah, and I find sometimes, I don't know what your experiences are as, family doctors, but some couples came back and told me they saw the doctor only once and they were only being treated by the nurses. And sometimes enough information was not given to them before they actually went through the cycle monitoring process, and they weren't aware of all the medications, the side effects and the effects of the medication. So it was a little bit hard for them to make the decision then. And, as a family physician, I had to step in and sort of explain things to them and give them a little bit of a reassuring, thing. Do you find that as well?
I haven't actually. No, I find that they are mostly the clinics that I refer to, they usually are seen by the doctors. So
at every visit?
I haven't heard otherwise. So they may be seen by NP, I'm not sure, but it hasn't come up as a concern. So
yeah. I think maybe also depends on what area they're living in, right? Like if it's a busy clinic, then sometimes they get seen by nurses or,
Mhm.
assistants.
Yeah.
Okay.
I think
Anybody else with any questions, concerns, or even if you want to bring up any point that, um, that is concerning you or a friend, we are happy to, talk about it. And if you want, you can always direct these questions to us personally later as well.
okay, so it seems like there aren't any questions at the moment, so we should be okay to end it here. But thank you very much once again, Sakinabin, and we look forward to your next talk on pregnancy, moving on from fertility.
Thank you. Thank you for giving me this opportunity. Appreciate it.
Thank you. Khuda Hafiz, everyone.